I know what I'm about to say may sound outrageous to some. But if you're over 70, and still going in for routine checkups every few months, you may actually be increasing your risk of early death. Yes, you heard me right. While doctors have long promoted the idea that more frequent visits equal longer life, new research is challenging that belief, and the truth may alarm you. Because what if I told you that some routine tests are exposing you to unnecessary radiation? Or that certain checkups could lead to overdiagnosis, overtreatment, and even mental decline? That many seniors are getting treated for problems they don't have. Or worse, are being prescribed medications that do more harm than good. As a practicing physician with over 30 years in geriatric medicine, I've watched thousands of patients follow the system obediently, only to wind up sicker, not healthier. And after decades of data, patterns, and painful wake-up calls, I can confidently say that in many cases, routine checkups are no longer about prevention. They're about profit. In this video, I'm going to share 5 alarming truths behind the routine checkups most seniors get, and how each one might be quietly shortening your lifespan without you realizing it. So if you're someone who wants to live longer, stay sharp, and protect your independence, this may be the most important health message you hear all year. Let's begin. Hey there, I'm Dr. Marcus Vail. And if this is your first time watching, welcome. On this channel, I cut through the noise, giving you science-backed, no-nonsense advice on how to live better after 60. No gimmicks. No sugarcoating. Just the truth. And if you're a returning viewer, welcome back. I'm proud of you for continuing to take charge of your health. You're in the right place. Because today, we're uncovering something that's been long overdue for discussion. Let's talk about the 5 silent dangers hiding behind routine medical checkups, especially for seniors. Because while screening and prevention can save lives, they can also hurt, when done blindly, excessively, or without context. Let's start with the first alarming truth. 1. Overdiagnosis, when finding too much can hurt you. Let me introduce you to Richard, a 72-year-old retiree from Tampa. Every 6 months, like clockwork, he got a full panel of tests done: blood work, PSA screenings, chest X-rays, and EKGs. He believed that by catching everything early, he was protecting his future. But one year, his doctor noticed a suspicious shadow on his chest X-ray. Panicked, they rushed him into a battery of scans, biopsies, and consultations. Turned out, it was a false alarm. A benign calcium deposit that had been there for years, completely harmless. But the emotional toll? Devastating. Richard lost sleep, withdrew from family, and spiraled into anxiety. He even began taking medication for prehypertension, caused by the stress of the tests. In the end, the checkup didn't help him, it hurt him. This is what we call overdiagnosis. It happens when a test finds an abnormality that would have never caused harm, but now becomes a medical issue. It's not just frustrating, it's dangerous. Overdiagnosis leads to unnecessary procedures, psychological distress, side effects from treatment, financial burden, and sometimes, irreversible complications. According to a 2020 study in the Journal of the American Medical Association, 1 in 3 cancers diagnosed in older adults would never have caused symptoms or death if left alone. But once it's found, it leads to biopsies, surgeries, and chemotherapy, all of which can be more harmful than helpful. And unfortunately, many routine checkups open the door to this exact scenario. We're not saying never get checked, but get smarter about what you're checking for. And that brings us to our next truth. 2. The cascade effect. One test leads to another, and another. Imagine a tiny snowball rolling down a hill. With each foot it travels, it gathers more snow, until it becomes an avalanche. That's exactly what happens when one medical test leads to another. And another. And another. It starts with something routine, say, a slightly elevated heart rate on an EKG. The doctor orders a stress test. Then a CT scan. Then a cardiology referral. Before you know it, you're taking beta blockers, scheduling heart catheterizations, and battling side effects from a problem that might not have even mattered. This is called the cascade effect, and it's especially dangerous for seniors. Because at this age, your body doesn't bounce back the way it used to. Even minor interventions can mean hospital stays, infections, blood thinners, long recovery times. Not to mention the emotional weight of thinking something is seriously wrong, when it might not be. Let me share a real-world example. A patient of mine, 75-year-old Eleanor, was told her thyroid levels were a little off during her yearly blood work. That triggered more blood work, which triggered an ultrasound, which triggered a biopsy. That led to a recommendation for surgery, which she agreed to. After surgery, she experienced vocal cord damage, persistent fatigue, and lost her ability to sing in her church choir, her favorite activity. And what did the biopsy show? A benign nodule. Again, not harmful. But the cascade of tests and treatments changed her life, not for the better. 3. Medication overload, when prevention becomes a pill parade. Let's take a step back and look at your medicine cabinet. How many bottles do you see? 5? 10? Maybe even 15. Now ask yourself, do you know exactly why you're taking each one? Many seniors are prescribed medications during checkups to prevent problems. Statins to prevent heart disease. PPIs to prevent ulcers. Antidepressants for, just in case, anxiety. Blood thinners to prevent stroke, even without a clear reason. Before long, they're dealing with dizziness, confusion, kidney stress, low blood pressure, increased fall risk. According to the CDC, more than 40% of adults over 65 take 5 or more prescription medications daily. And here's the kicker, many of these were never needed in the first place. They were prescribed based on numbers, not on symptoms or real risks. And those numbers? Often triggered by, you guessed it, routine checkups. This is one of the most tragic side effects I see in seniors. Medication overload. You get prescribed one thing. That causes a side effect. So you're prescribed something to fix that, which causes another issue, and the cycle continues. All from a routine visit that started with, just making sure you're okay. So far, we've uncovered overdiagnosis from routine screenings, false positives that cause real harm. The cascade effect. One test turns into dozens, leading to unnecessary treatments. Medication overload, pills upon pills, often without benefit. Now it's time for the final two truths, potentially the most dangerous. 4. Radiation exposure from routine imaging. Every time you undergo an X-ray, CT scan, or nuclear imaging test, your body absorbs radiation. It's invisible, but it's cumulative, and over time, it can cause DNA damage. For younger patients facing urgent issues, imaging is often essential to diagnosis. But for seniors attending routine checkups with no symptoms, the benefit is questionable. Here's why. A single CT scan of the chest can expose you to more radiation than 100 chest X-rays. Studies have shown that multiple scans over years can significantly increase your risk of developing cancer. When overused, imaging can outweigh the theoretical benefit of early disease detection. Let me be clear, I'm not saying never have imaging. If you have symptoms such as chest pain, persistent cough, or unexplained weight loss, your doctor should absolutely order the appropriate scans. What I am saying is this. If you're healthy, asymptomatic, and over 70, and your doctor orders a CT or X-ray, just to be safe, question it. Ask. What symptoms are we looking for? How likely is the test to change my treatment? What are the risks versus benefits? Since I started challenging unnecessary imaging, many of my patients have skipped scans with zero negative outcomes, and saved themselves exposure, anxiety, and expense. 5. The psychological toll, anxiety, stress, and cognitive decline. When you visit the clinic every few months expecting clean labs or reassuring scans, it creates an underlying tension, the anticipatory anxiety. You start to dread the results, your body becomes hyper-aware of every symptom, and you may find yourself checking your pulse, analyzing every ache and twinge. This chronic low-level stress creates elevated cortisol, sleep disturbances, memory difficulty, higher blood pressure, even physical aging at the cellular level. In fact, a 2018 paper in JAMA Psychiatry found that frequent medical visits, and especially ambiguous or borderline results, were linked to decreased cognitive function and increased depressive symptoms in older adults. This is greatest in those who already have mild memory complaints. What should have been a reassuring visit becomes emotional wear and tear that lasts for days or weeks. I've seen it happen time and again. Take Marjorie, a 78-year-old widow who used to shake uncontrollably before each checkup, imagining the worst. She'd stay up all night worrying, then freeze when she was there, too afraid to ask questions or advocate for herself. Over time, this pattern contributed to insomnia, memory problems, and even a benign tremor. When we structured her visit cadence down to once per year, and focused on comprehensive wellness, rather than repeated tests, her anxiety lessened, her sleep improved, and her memory stabilized. When routine checkups are beneficial, and when they're not. I want to be clear. Routine checkups can save lives, especially when done with precision and purpose. But the problem is in the default setting of medicine. Insurers, hospitals, and often doctors follow protocols that recommend frequent visits, scans, and labs, many of which are based on outdated guidelines. So how do you know the difference? Beneficial checkups include bone density scans as recommended, every 2 years once over 65. Colorectal cancer screening, if not yet completed. Blood pressure monitoring, ideally at home, not just in the clinic. A1C or fasting glucose if diabetic or prediabetic. A targeted cancer screening only if you're symptomatic or at known risk. These have clear directives and defined intervals. They don't cascade tests, and they're calibrated to clinical impact. Problematic checkups include routine full-body CT scans or brain MRIs without specific indication. Repeating imaging annually, just to be safe. Lab panels run more frequently than annual without cause. Medication reviews without deprescribing practices. Over-bundled screenings that aren't individually justified. Developing your senior health plan, avoid the pitfalls. Here's a simple framework I give my patients after 70. Step 1. Keep an annual well visit with your primary doctor, no more. Use it to review symptoms. Update essential screenings. Deprescribe unnecessary drugs. Discuss lifestyle and mental health. Step 2. Use targeted testing, not routine testing. Only get imaging or labs if you have new symptoms. You've not had the test in the recommended interval. You've had a change in condition. Step 3. Become your own advocate. If your doctor recommends a test, ask, how will it change my treatment? What are the risks? Are there less invasive ways to check? Most doctors appreciate this kind of thoughtfulness, not resistance. Step 4. Prioritize wellness over testing. Choose to invest your time and health into physical activity, mindful nutrition, quality sleep, meaningful connection. With these strong foundations, unnecessary scans and checkups become a distraction, not a solution. Real-life outcomes, patients who reclaim their health. Case 1, Robert, 80. Used to have annual scans and labs. When he stopped scans and refocused on fitness and diet, his balance, mood, and energy improved, and he avoided harmful procedures. Case 2, Lydia, 75. Experienced fear every checkup. When we cut back to annual symptom-based visits, her anxiety vanished. She regained the joy of living. Final thoughts for seniors and families. Routine checkups after 70 can be a double-edged sword. They're not inherently bad, but when overused, they can expose you to radiation. Trigger test cascades. Add unneeded medications. Cause anxiety and memory decline. But with better choices, better questions, and smarter intervals, you gain independence, clarity, and peace. You get the care your body truly needs, without harm. We've explored the 5 alarming truths. Overdiagnosis. Cascade testing. Medication overload. Radiation exposure. Psychological stress. Now, it's time to replace fear with empowerment. Let me introduce you to the Year of Wellness strategy, a smarter, gentler, more life-affirming vision for aging with dignity. This isn't a checklist for invasive procedures. It's a blueprint for living your best life, taking care of your body, and getting the care you should have, without letting the system overtake you. Wellness Pillar 1. Strengthen the foundation, daily habits for health. Before we dive into annual medical routines, let's reinforce your day-to-day living. The strongest protector against disease is your lifestyle. It's your first line of defense, even stronger than medicine. A. Movement and mobility. Aim for 20 to 30 minutes daily, ideally broken into shorter bursts. Combine aerobics, walking, light cardio, gardening, with strength, resistance bands, light weights, and balance, tai chi, stability exercises. Regular movement keeps your heart active, your neurons fired, and your bones resilient. B. Nutrition for longevity. Focus on whole foods, colorful vegetables, lean proteins, healthy fats, and low glycemic grains. Supplement wisely, vitamin D, magnesium, omega-3s, probiotics, but only after testing or with provider approval. Skip processed foods, artificial sweeteners, and inflammatory fats. C. Sleep as a daily practice. Keep a midday wind-down routine. Turn off screens 90 minutes before bed. Keep your bedroom cool, around 65 to 67 degrees Fahrenheit/18 to 19 degrees Celsius. Prioritize unmedicated deep sleep, using supplements like magnesium glycinate only when needed and with professional advice. D. Mind and meaning. Spend at least 10 minutes daily on reflection, gratitude, or purpose-focused journaling. Stay connected, schedule one meaningful contact daily, call, walk, letter. Pursue creative or learning activities, painting, gardening, crosswords, volunteering. These habits form the wellness foundation. With them in place, the need for reactive medical care lessens, and empowers you to choose only what truly adds value. Wellness Pillar 2, the annual checkup redefined. Here's the truth. If you want to thrive after 70, one good checkup per year is often more than enough, providing it's well-structured, intentional, and balanced. This is how I guide patients. Step 1. Symptom review and physical exam. Voice your questions, don't just nod. Share symptoms, sleep, mood, energy, digestion, memory, blood pressure concerns. Ask for a general exam, heart, lungs, abdomen, joint function, reflexes. Step 2. Targeted screening. Rather than random labs, focus on blood pressure in your usual setting, home cuff data recommended. A1C or fasting glucose. If diabetic or pre-diabetic, otherwise skip if normal. Lipid panel every 3 to 5 years if stable. Kidney function, creatinine, annually if diabetic, hypertensive, or on medications. Thyroid function if symptomatic, routine TSH every 2 to 3 years. Bone density scan every 2 years, age plus risk-based. Colonoscopy, mammogram, prostate screening, based on personalized risk. Step 3. Deprescribing assessment. Ask your doctor to review all medications, including OTC, supplements. Evaluate if each is still necessary. Identify any drug interactions. Consider tapering or stopping once no longer indicated. Step 4. Functional performance check. I include these tests in annual follow-ups. Timed walk, 4 to 6 meters to assess gait. Sit to stand test, 5 reps. Grip strength, if available. Basic cognitive screen, for forgetfulness. These practical markers show function, often better than lab values. Step 5. Preventive conversation. Discuss vaccines, flu, shingles, pneumonia, COVID boosters. Bone health, vitamin D, calcium. Nutrition or sleep needs. Vision and dental screenings. emotional support and purpose check-ins. And skip anything outside this menu, especially if you're doing well and symptom-free. How to talk to your doctor, be your own advocate. Effective communication is key. When your provider recommends tests, say, "What symptom are we investigating? How will this change my treatment? What are the downsides of doing, and not doing, it? Is there a non-invasive alternative?" These questions signal that you're an informed partner in your care, and often avoid unnecessary tests. Your simple annual wellness calendar. Here's a year-long schedule line, tailored for healthy seniors. January. Symptom review, exam, and labs, including blood pressure, glucose, lipids, kidney, and thyroid. February, April. Focus on lifestyle, 3-month check-ins on walking, sleep, and nutrition. May. Bone density, vaccines, and mobility tests. June, August. Check in on social engagements, mental health, and purpose. September. Fall risk assessment, vision, and dental follow-up. October. Wellness reflection, review the year's habits and set small goals for the next year. November. Adjust supplements and medications based on blood results and symptoms. December. Last check-in before the holidays, focus on keeping lifestyle habits consistent. You don't need serious medical interventions unless a symptom or test result calls for it. Real patients who thrived with this approach. Case 1, Warren, 77. Cut scans, labs, meds in half. Kept strength training, diet, sleep routines. Blood pressure improved, mental clarity increased, no new diagnoses. Case 2, Ellen, 80. Avoided unnecessary cancer screenings. Measured gait and memory annually. Volunteered weekly, stayed happy, connected, and fell only once in 2 years. Case 3, Michael, 82. Stopped 2 pills after reassessment. Reduced doctor visits to once a year. Spent more time gardening, writing, laughing daily. If routine checkups dominate your year, stop. They may be doing more harm than good. Embrace a smarter strategy. A balanced annual checkup, smart screening, symptom-driven tests, while you live your daily life with vigor, purpose, and intention. That's the path to true longevity, not fear-based medicine. If you believe it's time to question the medicine treadmill, like this video to support smarter aging. Comment below. Which truth surprised you most? What change will you make today? Share this with someone you love over 70. Subscribe for more real-life health wisdom from me, Dr. Marcus Vail. Your life isn't a set of numbers, it's a collection of moments, memories, and meaning. Let's protect what really matters. Until next time, stay informed, stay empowered, and live well.